Hi, good evening. Welcome to another episode of Let's Talk About Mental Health. Actually, our last episode for the second season. I'm Nels Kloster, and I'm an addiction psychiatrist. I work in Southern Vermont.
And my name is Robert Stack. I'm a licensed alcohol and drug counselor and a licensed mental health counselor. Good evening. How are you?
So,
well,
28th episode of season 2.
That's right. Another year's gone by.
Yeah, flew by. I wonder if they'll invite us back for next year.
So we have a couple questions that we should finish up answering.
Sure, let's get to that. So the first one is, I've been watching your discussions on recovery this season, and I'm wondering what's the best way to start my recovery? Okay, so this is obviously somebody who's been doing some thinking.
Yeah.
Right?
And I there's a little editing going on here because it would be interesting to know exactly what they're recovering from. I mean,
right, depression, alcohol, opiates.
Yeah, you know. And I would say that and you've heard me say this already before, that they've already started the recovery.
Right.
The sheer fact that they're, not just that they're listening to our show, obviously, but no, I mean that sort of inquisitiveness, you know, how do I do this? Yeah. And I think that's, without getting into the whole stages of change business, but the idea is that at this point, there was probably other points in their life, let's say hypothetically they're struggling with alcohol, where other people were under the impression that they should start their recovery. Right. But they weren't.
Right. Somebody else thought they had a problem. They're like, not me, I don't have a problem. You
right.
got a problem, leave me alone, right? Yeah.
So it is possible that somebody is watching this show while they're drinking, or intoxicated or under the influence, thinking, oh my God, they're talking about me, and how do I start this? And I think that would be the beginning. The beginning would be really that sort of inquisitiveness. And I also would imagine that they've tried to stop on their own a few times and been unable to do it. So we know, and you know, that most people who might meet the criteria for substance abuse anyway, or hedging toward severity, dependency, stop on their own, without going to a doctor, without going to AA, without going to hospital.
They never see us, they never get help, they do it on their own.
Yeah, they do it on their own for whatever reason, you know. Now they are at risk sometimes to pick it up later in life and think they're, you know, it's safe to use again, and may find that it's not. But that's probably the first thing. But when you get a question like this, you can almost assume that they've tried that a few times, and they're now looking for some kind of guidelines. Like, where do I go? How do I start this? Where do I go next?
Yeah. And it may be to be encouraging, too. I mean, you said, let's not talk about stages of change, but I feel compelled to anyway. You know, before they would have even thought to write this question, they're not thinking they have a problem. So the sheer fact of writing this question indicates that they've gone from, say pre-contemplation and not thinking about it, to contemplation and thinking about it. But I might even argue that now they're sort of in the preparation stage, which comes past contemplation, where they're saying, okay, you know what, I have a problem and I need help. I don't know how to get started, which is often then the predecessor to action, sort of takes some steps, whether it's going to a meeting, whether it is talking to their primary care doctor, reaching out for some sort of support group to try to feel better than they are right now.
Right. You know, I remember one time, and it's a very interesting idea. I worked in a hospital, and there was somebody who worked there, not in a clinical way, but they worked on the campus or whatever, and this is years ago, 20 years ago. And they actually struggled with alcoholism. And, they really did, and they had a hard time with it, and eventually, over the years, they ended up, I think, dying from it. And so, it's not a bad question. Like on some cases, some people know they're in trouble. They know their drinking's out of control, or their drug use is not what it, they're using it illegally, or they're abusing doctors' prescriptions. But they still can't figure out quite how do you start this? Like do you just start on Tuesday? Do you pick Wednesday? You know what I mean? Like, how do you begin this? And I think that probably the first thing that's so important for most people who are struggling is not to do it alone.
Right.
I think that's the beginning. Whether you contact a professional, you go see a therapist, or you go see a religious, spiritual person, even another family member. I mean,
Well,
just don't be in this alone.
absolutely. I mean, that's what I was thinking too, because one of the sort of classic bits of advice when you talk about quitting cigarette smoking is you set a date that you're going to put down the cigarettes. You start to prepare yourself, getting rid of all those things that encourage you to smoke, ashtrays, lighters, etc. But also, you announce the fact that you're going to quit smoking. On Tuesday, I am going to start stopping smoking. And there's a power in this, right? So it's making a commitment. It's sort of using the power of the pack then to say, I'm going to do this, and then you expect other people to be supportive of that. I mean, imagine that, just think about the power that comes if you were to say to your partner, honey, I think I'm depressed, I need to get some help, or I think I'm drinking too much, I should go see somebody, right?
And I've noticed, like at our local hospital, they have a lot of support groups for people with medical problems.
Right.
And they encourage them to come in and share their experience and with newcomers, but support each other. I've never been to Weight Watchers. I'm probably eligible at one point.
It strikes me as like a 12-step program for
no,
weight.
but it's like a support thing. If you ever see the ads, they talk about, and I've noticed lately that they're even going to great lengths to say, it's not about shame. We're not going to tell you what to do. We're not going to yell at you if you have some special food or something. You know what I mean?
If you gained weight between meetings, okay, that happens.
It's really about support. It's about not doing it alone. It's about having a long-term goal. So I guess, for someone, and again, I'm sort of hesitant about this because I'm not sure what the recovery's from. And there could be some medical problems involved, depending upon what drug it is, how long they've been using it, how much. And so, I feel like I have to say, involve your PCP, involve your primary care physician. Make sure that if you need to, that you utilize medical personnel, hospitals, counselors.
Yeah, because I think it's fair to say, I know here in Brattleboro, BMH has programs around mental health and physical issues. I think any hospital in any community in Vermont has some sort of outreach or education or support. So yeah, so your primary care doctor or your local hospital,
that's right.
I think it'd be a wealth of information.
And I think the hardest thing, and you'll hear this sometimes in recovery, people talk about the 500-pound phone. You can't pick it up, And I think that, like maybe this is one of the things that we hope to do with this show was to encourage people to, ask questions, not be seen, not be known by us, who they are, where they are, but maybe make that your first step, but the next thing is to call somebody personally, give them your name, tell them what the problem is, go in and see somebody and talk about it. And I'd be, if it is alcohol, go to one of the open AA meetings, get some literature. Don't be shy. They're everywhere. There's a lot of church basements. There's meetings and stuff. If it's Narcotics Anonymous. There's a number of meetings.
And don't be discouraged if your initial attempts don't seem to get any traction.
Right.
There are many, so we say, sort of false starts on the way to recovery before one finally develops some traction. So persistence is really very important here. But not to shame yourself,
right?
Because you have no idea what lays in store once you start on the path.
That's right. And I think for a lot of people, they feel sort of doomed that they're never going to stop, that they can't stop. Matter of fact, they have stopped a number of times, but they've gone back to using, and then they start to feel. AA talks about being powerless, but a lot of folks will begin to feel hopeless. Like, this is, there's just no way out of this, and I just have to live with this illness. When really, that's probably not necessary. That they can learn to live in recovery, and I think that's another thing is to get hope, to understand that there is a possibility of recovery. People do get better, and you just make a beginning. And I'm a big fan of showing up. I think showing up is you can't do it if you don't show up. So you got to show up. You got to put yourself out there.
Hey, beginnings are exciting. I think that's why we have so many more beginnings than we do follow-throughs.
Yeah.
Well, it looks like our comments there lead into this next question. That, I've been in and out of treatment many times, but I keep ending up at square one with my recovery. How can I push myself further? Yeah. The first thing that jumps out at me with this question is the idea of ending up at square one, which sounds like, again, starting all over again, right? Like the Monopoly, go to jail, don't pass go, don't collect $200. You know, I think that you know, nobody starts back at square one, like we've talked about previously. The fact of wanting to change, of having the intent, and then taking some actions about that, puts you in a completely different place. Even if you do, you know, relapse and return to being depressed, or return to drinking, or return to drugs, the fact that you've been through that once sort of gives you a little bit of a foundation starting to build up for then subsequent attempts to start over again. So it's never back at the beginning. I think that the way I like to look at it is, while it might seem like you're repeating destiny, sort of going around the same circle and getting nowhere, I think that each time you get to that point, you're at a higher and higher level until finally it sort of builds up to a peak where you can then, you know, see that you're actually making some progress and you're far from square one.
That's right. And I remember reading an article one time. It was in I think it was the Burlington Free Press. They were talking about a certain method of treatment that was successful, and they said, you know, my previous 3 treatments didn't work, but this is the one that's working. And I think that's and like you're saying, you have to be careful about that. Just that the idea is that the other ones, that he may have relapsed, but that doesn't mean they weren't unsuccessful. And as you know, sometimes, you know, each treatment addresses another issue. Yeah. Sometimes the first treatment does nothing more than to break through denial and get somebody to move into contemplation of changing their life or something. You know what I mean? And the second treatment is somebody says, well, thank you for all that information. Now that I got that information, I really know how to do it, and I think I can do it without medication, without therapy, and without 12-step. Yeah. And the third time they come back, they go, well, look, maybe this time I really need to do, you know, some of the things you suggested. Yeah. And so I think that, you know, like you're saying, I don't think any treatment is wasted, whether it's outpatient or inpatient. I don't think it's ever wasted per se. I think sometimes some treatment is inappropriate. You know, you and I did a class with the diversion group last week. We met with them, and they said, you know, we meet with them one time, we get one chance to talk to them. What do you say? What's helpful? And it's so hard to know where the client is who's in front of you. Yeah. You know what I mean? Like, you know, where are they? There's a Buddhist saying that, you know, when a student is ready, the teacher will appear. But when the student is not ready, does it matter what the teacher said?
You know, maybe not. I know that, you know, we've done this a lot, right? That idea of a single meeting and being expert enough to get what's going on and send them the right path. You know, I've given up on achieving that level, because there's just so many times you know you've got it done, you know what's going on, you engage in a plan to move ahead, and then you find out, wow, it's just way off base, and you have to sort of rework the whole sort of contract of treatment, or you know, develop another theory. So I hate, well, one of the things that really appealed to me when I was in medical school is one of the psychiatrists at UVM, John Hughes, had told us about his two bits theory. So what it was, everybody's always putting their 2 bits that, you know, you need to change, or you could do something different, whether it's their, you know, their partner, or family member, or friend, or coworker, you know, minister, whatever, the police, you know, who knows, and that the person who puts in the last 2 bits shouldn't think they did anything magical around persuading this person to choose a different path, because really your 2 bits is just one more on top of all the others that finally adds up to a weight that will motivate somebody to take a different path, to make some changes.
You know, and one of the things that we know about addiction and alcoholism is that it's a chronic illness, and there's no absolute cure. There is a TV commercial for a treatment center somewhere that says, you know, we have the cure or something, but there is no
Malibu
cure.
Beach, California.
I don't think there's a cure per se for it. And I think one of the things that you have to realize, that when you're clean and sober, when you're, you know, say everything you want to say to somebody. Yeah. Tell your family, talk to folks. You know, do whatever you can to have a good quality of life. And if you relapse, and hopefully over time your relapses will get. I mean, I've said this before, but I'll say it again. It's almost as if your disease is progressive, but so is recovery progressive. Mm-hmm. But the problem is that with people who relapse, it's almost like a race to see which one wins out at the end. Mm-hmm. Well, you know what I mean? Like, you know, because sometimes, even though your relapses sometimes are shorter in duration, sometimes they're more severe. or you have more problems, and they get worse. But yet when you're sober and you're clean and you've had that experience, sometimes life gets better and you're getting better. And so I almost see it sometimes over the years when I was working. I would work with clients who had relapsed, and their relapses were horrible, and they felt terrible about them. There were a lot of shame and guilt about them. But when I asked them about it, it would turn out that they actually had good periods of recovery where they did good things and they were, making progress. And so I think I would really like to take some of the shame of relapse out of addiction. And, that's fancy talk. But, just recognize it for what it is. Learn from it. If you're making mistakes, if you're, if you're going back and using again and again, did you go back and hang around with people that you shouldn't have been with? Yeah. What else was going on in your life? And do you really want to stop? And I mean,
Yeah, that's a big question, and we learn more when we fail. We make mistakes. So again, there's this tendency with social cognitive distortions and having sort of low feelings about ourselves that we're more prone to look at these things in a negative light. Can you imagine? Hey, I messed up. Great, I'm going to learn so much.
Yeah.
Really, it's very, very hard. I mean, nobody says that. So to somehow sort of infuse that into somebody's treatment and infuse that into somebody's recovery, I think would do a real service to people.
And I think one of the things that's up there that sort of strikes me, and this might be because of my background in all the years in treatment centers and support of AA and 12-step programs, it says, how can I push myself further? And you'll hear sometimes AA is referred to as a we program, and that it's not about the I. And I think one of the dangers for some folks is that when they feel like they have it under control, their ego, basically, I have it under control. If I can control it, then why can't I start again? And I think that's one of the dilemmas for folks who go to treatment and they stop using. They find out they can stop. They can go through it without using every day. And so it almost becomes a sort of intellectual question. Well, if I know how to stop, why can't I
start again?
Why can't I start again? Have a weekend where I drink or more or whatever, and then stop. And, why don't I try some controlled drinking for a while and see how that goes? Or, so, that tendency to sort of negotiate your abstinence. And so I think, on some level, it's a real risk factor for like somebody who feels like they're doing it, the I's doing it, the ego's doing it, because it's so tempting to believe that if I can stop, then why can't I start and stop again? And I think that's one of the things that is, when I hear somebody say that, I've been in and out of treatment, I suspect that they continue to get to a point in their abstinence where they begin to assume that they're in control. Yeah. And, it's really their choice. Yeah. So, anyway.
Dangerous place to be.
Right. And last time, at least, I should say that occasionally with some folks that I've worked with, there were other issues they weren't addressing. There were other things that they needed to sort of work on, and they didn't want to do that. They decided they didn't want to do it. It's like going to AA but not wanting to do have a spiritual life. Mm-hmm. You can get away with that for a while, but at some point, it's like going to therapy but not telling anybody the truth. It's like, or going on medicine but not taking your medication. I mean, you really have to sort of take a look at it. Is there a pattern of relapse, and is there a period of time you stay sober and then you go back to using? If there is a pattern, what is the pattern?
Because it sounds like, those are some common things that we've experienced through our careers, and there's a superficiality there, right? I'm giving the appearance of taking medications. I'm giving the appearance of being engaged in the 12 steps. I'm giving the appearance of being in therapy, but you're not really genuinely involved. You're just kind of lukewarm and kind of on the outside of it, as opposed to really diving into it and taking that chance and developing from it.
That's right. And I think, yes. And again, not to be in judgment of the person. We don't know them. We don't know what the struggle is like for them.
Yeah.
Appreciate the question. And it's interesting because I used to ask, which person is which person really is more aware of the need for recovery? Somebody who goes to treatment once and never uses again, or somebody who's been in treatment a couple times, a number of times, and keeps coming back? And which person is really more courageous? Which person is more committed to recovery? You know, I appreciate and I applaud the person who goes to treatment once and never uses again, or the person who quits on their own. I mean, more power to them. That's a wonderful story.
Yeah.
But I think on some level, that person that struggles and struggles and struggles and keeps going back in treatment. I remember one time I heard somebody say, that person doesn't get it. And I said, no, I think they get it.
Maybe we don't get it.
I think they get it, but they don't know how to grab it. You know what I mean? Like, you know, and they know it's there and they want it, but yet they don't quite get it. And so, you know, you have to sort of, you know, give them some credit sometimes. You have to acknowledge it.
Yeah.
You know, there's no cure for it. It's a chronic illness.
Yeah.
And I worked with a Dr. Mandel, and I remember this. He had this funny thing he used to say in treatment plan. I know, I really like it. He used to, because sometimes you could be critical, you know, about.
Yeah.
And he said, remember, the patient is always doing the best they can.
Yeah.
And you know, you look at them, you go, no, they could do better. You know, like a parent, you know, no, they could do better. You know, and you go, well, maybe if they could, they would have. They're probably doing the best they can, and that. I've never forgotten that. I mean, I've always sort of tried and tuck that in there. You know, it's you know, sometimes when you look at somebody, like I can't help thinking about, you know, before we learned about learning disabilities, and when I was growing up, there was kids in my class that had trouble with reading, and I don't think anybody picked up on it.
Yeah.
You know what I mean? I don't think anybody realized it, and they were seen as dumb, or they were seen as, you know, troublemakers or stuff. You know, and you know what Dr. Mandel said, they were probably doing the best they could, quite frankly, you know. So that's always good to remember. At least that's good to remember.
Well, it's a kind approach. It's a much kinder approach. I like that too, because then hopefully somebody will look at me someday and say I'm doing the best I can.
That's right. That's right. That is true.
Yeah.
And then, you know, that's the birth of empathy. If you can sort of put yourself in the other person's shoes and.
Yeah, and usually we have to get sick to be able to do that fully.
Yeah, well, I think we all are flawed.
I agreed.
You know, some of us are blind, but some of us, but I think we all are flawed. Anyway, so thank you for those questions.
Like they were themed, they hung together nicely.
That's right. And then now I'd like to take just a couple moments, if you don't mind.
Yeah, we're getting ready to go on summer break.
This is great. This is great. You know, we've done this. This is our second year together. It's been great. This year we've had. Well, we started off really well.
Yeah, we had Mary Ellen Copeland come up to talk about the Wellness and Recovery Action Program that, you know, really appealed to us because of that idea of taking responsibility, developing a network, and sort of educating yourself about your illnesses. Right.
We've also had John Moran on, Representative John Moran came on at one point. He wanted to talk a little bit about what was going on in the legislature. Yeah. That was great. I hope we have him on again some point.
Right, yeah. Catch us up. There's a lot of action this session. Yeah. The Women's Freedom Center, they came and visited us, as well as at Pathways to Housing.
And both of them were, I think, critical pieces. I mean, both of them were sort of like alcoholism and mental illness are part of this picture. Yeah. And then part of this picture for Pathways, you know, the importance of housing and support and a supportive environment. And the two women that came from the Women's
Freedom Center.
Freedom Center. And their talk about being supportive and being supportive of the person involved. You know, I think that's great. Again, the idea, please don't do this alone. You know, want more people involved.
And then and we had you know, Leslie Fishman on a couple weeks ago. You know, a good friend of ours, to talk about sort of pain treatment and the unintended consequences of thinking we're doing well, and then later on finding out we weren't really doing as great a job as we thought we were around pain treatment.
Right. I really enjoyed her show, and matter of fact, it's one of the shows that normally when I see our show on TV, I'll look at it for a little while. I can't look at it too much, but I really like listening to her. I thought she was really, really just smart.
Yeah. Well, and hopefully, you know, the thing that always fascinated us with her was to talk about spirituality, and her sort of, you know, connecting that to sort of the mechanisms of the brain, and you know, basically us as human beings, as you know, social creatures as well as you know physical beings, and how spirituality is no less fascinating when you look at it from those perspectives.
And you know, it's always interests me sometimes. You know, I remember I was working with a doctor at the hospital, and someone complained about his handwriting or something. I don't know, some foolishness. Yeah. And the person I respected was sitting next to me and said, "Well, that may be, but he's very, very good with the patients." And I've always thought about that, and I think about that about Dr. Fishelman. I mean, I don't care what you say about her, but the patients love her. She is very, very good with the patients, and I don't think you can say a better compliment. And and I mean that. I mean, really.
Agreed.
Frankly,
I mean, if anybody ever complained about her or Jeff Kane, who we worked with, I was like, I think it's on you.
Yeah, no, you got to listen. Yeah. I mean, you know, 29 years in the hospital, I've worked with a number of doctors, you know, and there's a lot of ways to judge them. There's a lot of ways to think about them, but I think, you know, the first one on the list is how do they do with patients? You know, how do the patients come away? Anyway, so that was a great show.
Because that is the point of it.
We have Mark Ames on.
That's right, to talk about...
and he was talking about the recovery centers, the turning points throughout the state.
Right.
And maybe some of the stuff that's going on there and the support groups. Yeah,
a nice bridge between sort of the traditional sort of 12-step communities and, you know, medication approach, that nice bridge between those. There are elements of all of this that are valuable and vital.
Yeah, and I like also about the turning points, and we went up there and did a talk up in White River with a bunch of the directors, managers from Turning Points, and that was really nice to meet those folks. I mean, they're talking about setting up a coaching system for people with medication-assisted therapy, methadone and Suboxone being two of them. And I thought that was great. I mean, I think that's the kind of thing that a lot of people in the community, and this is one of the things, you know, we talked about this before, Governor Shumlin putting the spotlight on heroin addiction and everything. And I'm glad he did. But I'd also like a lot more of the spotlight to go on the people who are working in the trenches in recovery, the people who are working in the field trying to help people get better.
Right, because I mean, opiates have been a problem for thousands of years, and it seemed to, you know, peak at various times. And there have been a lot of people on the ground. There's a lot of, you know, foundational work that's been going on in Vermont that preceded, you know, the governor's State of the State address by a number of years. So that's, you know, that's very important. And that's people who really are just heads down doing the work that's needed to be done.
And it's interesting. We've saved them for last, but Robert Whitaker, we've had him on, right? I say that correctly?
Yes.
And he wrote these two books, and we had him on, and they showed it on BCTV. They also showed us the talk he gave at the library. But reading his books about psychiatric medications and how we need to think about this a little bit, and what the evidence shows and the data shows, it's really made me like think about this. That's been a very learning experience for me.
Yeah, it's possible. I mean, it's, you know, you talk about paradigm shifts, that there are times when somebody looks at what you do in a different light, says the emperor has no clothes, and you start to wonder, oh my goodness, is what I'm doing, is it true? Is it the right way to go? And sort of, I wonder if that's going to reach a tipping point where we realize that we've been, you know, led down a wrong path, this over-reliance on pharmaceuticals, that they're not as effective as people think they are, and that may be even sort of harmful, but certainly lend a certain passivity towards one's approach to mental health that is contrary to what all the other guests we've had this season have talked about. And
I think it's good, though, I mean, to have that kind of discussion, if you will, where somebody comes in and says, you know, this is the accepted model, but we think there might be another way of thinking about this, and let's take another look at this, because I think we fall into that trap.
Yeah, and as we go into next season, I think those are the issues we're going to try to explore, right? Does this paradigm need to shift? Do we need to rethink the way we've been doing things?
Definitely. And, you know, what do we need to take a look at for next year? Well, thank you all very much. Thank you for having me.